Hi, and welcome back to PatientRx. I'm Jessica Krauser,
And I'm Tina Valb.
and we are here at Assembia Specialty Pharmacy Conference 2025. We are at SiriusXM Studios at the Wynn Las Vegas, and we are so excited to be here. I've come for the past 7 years. How long have you been coming?
Lost count, I think.
I think that's how it was. Yeah.
When it was called Armada,
Oh, I've
they had a
heard
different
that.
name.
Yeah.
Now it's Assembia, and
Yeah.
I always want to still call it Armada. But I've been coming here for years and
That's
years and
awesome.
years, and it's
So great to see people like
yeah.
I remember the first year I came, I felt like I didn't know anybody. And now that I come back and I'm like, oh my God, I'd like see
Yeah.
so many people that
It's like seeing-
which is great because you want to have, as a patient, you want to know that the people that are helping care, they're not doctors, but they're helping care for us because these are the ones that are helping to make changes within the pharmaceutical industry and how to make things better for the patient.
Yeah.
Which is a lot of people, but happens to be us, which is why we're here with PatientRx.
Exactly. These are the decision makers. So
Yes, yeah.
These are the folks we definitely want to talk about.
So I wanted to talk to you about something that happened last week. I posted a video.
Okay.
So as you know, I have the Secret Life of Parkinson's podcast for patients. And I was having really not a great month. I had like a good month, and then I had a really bad month with Parkinson's. And so I posted only because a lot of people that follow me with Parkinson's or caregivers, they like to see one that they're not alone in certain things that they experience. And there's so many things that affect us that are invisible. And one of the things that has started affecting me is somebody mentioned it, said it really, really well, but like getting your brain to say or getting your mouth to say like what is happening in your head.
Yeah.
Speaking clearly, speaking what your thoughts are. I can't connect the two sometimes. And it's so frustrating. And so I got off a conference call and I literally started crying. And I never cry. So I posted it because I'm like, I know this happens a lot to people. I got so many comments, but so many of the comments were saying, I'm so glad you posted this because I know how my husband feels because he won't talk about it. He won't even talk to the doctor about it, but I know it happens and I know he's struggling with it. Or, I don't feel alone anymore. And I'm so, but I feel, you talking about it makes me feel more empowered to bring it up with people or whatever it may be. So my question and my concern is that are there areas within certain diseases that patients aren't bringing up, and therefore even though it's something that's really frustrating, there's no solve because doctors and researchers and scientists, you don't know what you don't know
Yeah.
unless it's being brought up. So what do we do?
It is definitely, I think, an issue where patients hide maybe some symptom or even side effects of medication. And I think sometimes it's related to either they're afraid they're going to be taken off the medication, or maybe there's that lack of trust or them feeling that they could really bring something up. Or maybe, I know for me personally, there are times when I feel like it's a rush going into the office and they're definitely rushing. And if I don't have everything written down, then I won't ask it. And then I could see them halfway through the door and then I'll say, oh, wait. And then, so I think that patients feel maybe a little, what's the word I'm looking for? See, my brain.
I know. And I know you do.
I get a ton of brain fog after chemo.
And so many people, there was a few people that commented actually said, they're like, I hate when other people try and compare and say like, oh yeah, that, it's normal. I get that too, old age. And it's like, it's not. It's like the medications and stuff that you're on. It's the way my brain now operates. Mine is actually due to the impact of stress and Parkinson's, like how it mixes together. But yeah, it's interesting because I know we fight with that a lot and we try and help each other.
Same boat. Like my brain doesn't connect, and I know it. Like
I know what I want to say,
but it doesn't come out. And I've started to think maybe I just need to pause and maybe it's also a symptom of us women wanting to do too much at one time, right? But I've just like started to pause, and I'm just like, give me a second, just give me a second, and I have to like recalibrate.
Yeah. So what I was going to say though, with people, at least the ones that I know, the people with Parkinson's, when they go to the doctor, a lot of times they don't bring this stuff up because they don't want to admit the decline. because it's a
Makes a lot
progressive
of
disease.
sense.
Yeah. And
Yeah.
it's because it's not progressive on like a daily basis, but it's like, when I hit my 4-year mark, I really started, I was like, there's a difference now. Like I'm still good,
Yeah.
but I definitely can tell. And it's just one of those things that it's like, okay, is this just because I have a lot going on that it's the speech part is an issue, or is it just the start of the progression? And so I get it. It's like, it kind of sucks and you don't want to admit to that. But at the same time, if you don't tell anybody, there's no way, like, how do you slow it down? Or like,
Right.
same thing. If you don't tell anybody you have Parkinson's, how do you notice that you can slow it down by exercising?
How do we empower patients then?
That's a good question.
How do you empower? Is that a behavior?
But some people just, yeah,
or
it
is
is.
that just like building confidence?
It's probably building confidence, but I think at the same time, I think it's, how can we as an industry look at where to find problems in a different way or a different area?
Maybe be proactive. I know there's been times through my cancer journey where I was afraid to speak up.
Mm.
And I'm a healthcare professional. I'm a pharmacist. And even I was like, oh, I don't know if I should talk about that.
So I wonder, and I don't know this answer, so it would be interesting if somebody shared, or even if but where do the researchers, like, building on things right now, where are they getting the information of, like, because again with Parkinson's, there's still so many things that come out that people are like, I didn't know that was connected, like, or realize it, but it's like, do they know how big of an issue it is? Because, like, they're like, well, no, my patients don't really talk about it that much. It's like, well, is there a reason? Like, hallucinations is huge. People don't want to talk about it because they're afraid that they're giving into something or saying something that's embarrassing. Like, I'm seeing animals walk by, but if they don't say it early on enough, then they can't get the support that they need.
Yeah, I do think that patients constantly need to be educated. I don't feel like it's a one and done thing. Early on when you get diagnosed with any disease, you get a whole flood of information. And then as you live with that disease day in and day out and years on end, I do think that somewhere in between there, patients need to at least get constantly educated.
Yeah.
And the question is, who is responsible to do that? Is it the pharmacy that you get your prescriptions from? Is it the doctor's office? Is it like who's responsible to bring that new information? My
pill alarm is going off.
Well, at least we know you are being adherent and that a pill reminder works.
It does. I have to do it all the time. And I have it on when I'm on the Secret Life of Parkinson's podcast. I mentioned it one time. I was like, I should really mute that when I know I'm going to be on for that long of time.
Yeah, I think it's great.
A couple people commented and they said the same thing. They're like, no, keep it on because it shows the reality of, like, oh, you're just like me. I have to take my pills, 4 or 5 times a day. And it's
absolutely
so annoying.
No, I mean, absolutely. Really shows the daily.
Yeah.
Right, your daily life living with Parkinson's.
And like you saw for the past half hour, that was I'm coming off my meds, and that's why I'm tremoring. Thankfully, you guys can't see underneath the table. But then in a half hour, once I'm on my medication, which that'll be the next segment that I'm sure we'll be taping, I'll be moving all over the place because I'll be overly medicated. So it's a fun balance. So anyways, I'm going to end it with that just because I do have to take my medication. So thank you so much again for joining, and please tune in for our next episode here at Assembia.